So I have a question. What do you think would happen to your body if you actually did not sleep for 72 hours? Let's talk about it. Well, at 24 hours of no sleep, you're going to feel a lot of drowsiness. You're going to feel irritable. You're going to have impaired judgment. It's going to affect your memory. You're going to have more muscle tension, more stress, and you're actually going to be at risk for accidents if you're driving. Okay. Now, at 36 hours, your cortisol is going to go up, which is going to release a lot of sugar in your body, in your liver, which is going to affect your insulin. So your cortisol is going to go up, your insulin is going to go up, but your growth hormone is going to go down. And that's directly related to your ability to repair muscle and also repair all your proteins in your body and also lose weight. So growth hormone is like the anti-aging hormone, so you might age faster than you should. Your appetite will go up. I've noticed this. If I don't get enough sleep, like I'm hungrier. Your metabolism will go down. I've seen this with a lot of people who are trying to lose weight, but they're not sleeping. Well, your metabolism goes down when you're not sleeping. Moodiness, okay? Higher stress levels. You're going to be extremely tired. Hormonal imbalance, poor reasoning, decreased motivation. And so if you have poor reasoning or you feel like you don't have enough more motivation or you're tired, it could be that you're just not getting the quality of sleep, okay? Because it's not just the quantity of sleep, it's the quality of sleep. So if you have any of these symptoms, you want to watch my videos on increasing the quality of your sleep. Okay, at 48 hours, 2 days, staying up, not sleeping, your body might be shutting down periodically for 30 seconds just to get what's called a micro sleep. Now, when I was in basic training, Fort Jackson, South Carolina, when I was in the military, I literally fell asleep standing in line. I was so tired. And I didn't even know what happened. I just kind of went out and then went back in. This could be very dangerous if you're driving, right? You just kind of go unconscious. And then when you wake up, you're confused and you're disoriented, not very healthy. At 48 hours of no sleep, your immune system is going to greatly suffer. Your natural killer cells, part of the immune cells, are going to go down. So you're not going to be able to fight cancer. You're not going to be able to kill viruses. So it makes you very susceptible to getting sick. All right, at 72 hours, you're going to have a profound inability to think. You're not going to be able to have good judgment. In fact, anytime you're tired, you shouldn't make any very important decisions, okay? You're not going to be able to pay attention, so that's going to affect your relationships. You might get in fights more with your partner or your spouse. You're not going to be able to remember details too well. You're not going to be able to finish projects. You're going to be very dispersed, very irritated. You might even have illusions or altered perceptions. So this video is just to point out how important sleep is. And there are a lot of things that you can do to improve your sleep. I put a link down below of some videos that you definitely should watch. So today we're going to answer the very, very vital, important question, why you should sleep with a pillow between your legs. So number one, it can actually reduce your low back pain or prevent low back pain from occurring, because what happens when you lay on your side is your knees come together and it rotates your hips forward. So your spine is not in alignment. So if you're laying there throughout the night, several hours or more, with your pelvis rotated to forward, that's going to put strain on your lower back and throw out your alignment just enough to create some distortion in your spine. Now, this can also tug on the largest nerve in the body, the sciatic nerve, and also irritate that nerve. And number three, it can reduce knee pain, because if your knees are held together with pressure, that can irritate the knees, especially the inside of the knee where you have the medial meniscus, which is probably the most common source of knee pain, where you have either a tear on the medial meniscus or some type of weakness in that area. Number four, it can reduce hip pain, okay? And number five, it can improve your breathing, because if you have sleep apnea or some type of sinus problem and you're sleeping on your back, that alone can reduce the air that travels through the back of the throat. So by sleeping on the side, that'll increase air going through your sinuses, I would also try to recommend sleeping on your right side instead of the left side. You may find that you have a better sleep, especially if you have liver problems, because the liver is on the right side. So if you sleep on the left side, you have this heavy organ that can somewhat compress the lungs and reduce the air that's traveling through your body. So I always like to sleep on the right side primarily. And so that way the lung isn't interfered with the heavy liver, which is about 3.5 pounds. So try it out. It may work for you. Now, as far as the pillow size, I like to use something that is a flatter pillow, not too big, actually not too small, just enough to raise up the knee so my spine is level. So you would just want to test that out. Hey, before you leave, I just wanted to give you a little quick history on some of the books that I wrote. This was one of the first books. It's called Dr. Berg Body Shapes. It was my attempt at writing about body types. What was very interesting about this book is I actually did all the images myself. Don't ask me why. They look actually not quite as professional as some of the images that I have in the new book. But anyway, this is my first attempt right here called Dr. Berg's Body Shape Diets. And then I wrote a book more extensive called The 7 Principles of Fat Burning. I don't even have a copy anymore, actually, because it's outdated. The next book, I put about 1,000 hours into this one right here called The New Body Type Guide. Major updates on the body types. I put a lot of energy into this. It has professional images, graphics, all sorts of things. Now, the problem with this book is it doesn't really describe what this is really about. Body types are only a small portion of what's in this book. And that's why I changed the name to the Healthy Keto Plan, okay? If you happen to have this book, you don't really need this book because there's some only very, very minor updates. But if you don't have this, you need to get this one right here. This book goes into every single detail that you would ever want to know about. It goes into the 7 principles of fat burning. It goes into hormones, the body types, the basic keto plan. It goes into intermittent fasting. I talk about the 10 fat burning triggers and blockers and fat burning strategies with a lot of details in every single chapter. I go into body issues that interfere with losing weight. There's very few people that just have a weight problem. They have a lot of body issues, whether it's sleeping problems, stress problems, inflammation, menopause. I cover that extensively in this book. Then I talk about how to get rid of stress, and I show you a technique. Then I get into exercising. And then I have a lot of really good recipes in this book as well. So this is a good reference guide. On my website, if you get this book, you get this one free. It's called Healthy Keto and Intermittent Fasting. This is the shortcut, quick guide to this book. And the reason I created this book is to have you, within 45 minutes, learn how to do keto, okay, in intermittent fasting, exactly what you need to do. Then you can fill in the blanks with this book right here. So right now I'm doing a special. If you get this book, you get this one totally free, or you can go to Amazon and get these individually. So I just want to clarify the difference between this book and this updated one right here. If you don't have this, you need to get this right here. That way you can get the exact correct information to do it healthily.